There's a lot of things you can expect that person to go through. And they're not always going to be the same, which is another thing that's really important to keep in mind, is that there are variations in the process of adjustment. There most certainly will be a grieving process of some sort. Now, grieving processes can look very different. I think some people are familiar with the stage model of grieving, Elisabeth Kübler-Ross, which is 5 different stages that go in a particular order. Well, what we now know in a more contemporary setting is that these stages certainly do exist, but they don't necessarily occur in such a predictable order. And they're not necessarily clean and neat and observable. They flow back and forth. So somebody might start feeling very angry, or somebody might start feeling very depressed, or somebody might actually start feeling acceptance and then go back into some of those other stages where they feel depressed or angry. Certainly we hear some newly injured people having thoughts of suicide, making comments that they'd rather be dead than be going through what they're going through. Now, if you can, in that moment, that's a very scary thing to hear from a loved one or a family member. But of course, can be understood by taking a step back and asking, and looking at the situation. And I think in those moments, it's very important to be there with the person, to balance validating how they're feeling with some kind of statement of moving forward. We're going to be able to figure this out somehow.